Hello everybody, Roberto Park with Innovative Sports Training. Time for a Health Detective Talk discussion today. Today's topic is, what is the genesis of most of our diseases in our industrialized society? Now, I've done a lot of lab work on patients and clients in the past, looking at a lot of labs, looking at blood work. I've gotten more into that in the last few years, trying to help people overcome certain obstacles in their life, trying to reduce the aging process, trying to find those hidden stressors that sometimes pull you down and make you feel bad. You have joint issues, you have arthritis, you have type 2 diabetes, you have insulin resistance, you're losing your hair. A lot of things can happen. All those things are the disease process, really. Even when you have extreme muscle soreness, that's a disease process, believe it or not. So what really is the cause of these chronic diseases that people are battling day in, day out, and almost year in, year out? Well, let's peel off the layers here. What I've seen and what I've talked about with other people in my field and listened to different experts in the field, high insulin. Now, insulin is a hormone that pretty much escorts sugar to the tissues of the body, glucose, sugar. Now, we have such high insulin due to too many grain products, too many sugars, and too much dairy. Now, some people will disagree with me on dairy. That's fine. The reason I lump dairy in there is because it is still considered basically a sugar. Now, if you look at grain, that's maltose. You look at sugar, that is sucrose. You look at dairy, that is lactose, O-S-E. It's still a part of the osis family, which means sugar. Americans, not just Americans, but all in industrialized society, we consume way too much grain, way too much dairy, and sugar. Now, the next one is stress. Stress can be what I look for with some biomarkers. I look for high cortisol, I look for high adrenaline, and typically those are caused by food intake, lack of sleep, too much work, too many toxins in the environment. That could also include plastics, exercise, lack of exercise, and believe it or not, sometimes too much exercise can cause stress, lack of activity, too much activity. The thing I look for are cortisol swings. There is a test you can take which will measure your cortisol rhythm throughout the day. You have to take it. It is a saliva spit test. You have to take it morning, noon, late afternoon, and evening before you go to bed. Now I want to jump back up here to insulin, okay, in the green sugar dairy area. The biomarkers that I look for here are hemoglobin A1C, triglycerides, glucose, and measure insulin. Now these two are interrelated here, stress and insulin, because high insulin from grain, sugar, dairy can cause stress on the system, which will make your cortisol go up. Cortisol is a glucocorticoid hormone, meaning that it helps to escort glucose to the tissues of the body. So when glucose is out of control, chances are you're going to have high cortisol. Okay? Now, the third one is an underperforming thyroid. Now, the thyroid usually gets beat up because of these two factors, because of what's going on with insulin and what's going on with stress. Now the thyroid takes a beating. Now, you might say that, okay, I just go to the doctor and take some thyroid medication. To me, that's treating the symptom. You need to look at what is causing the thyroid to act up. Insulin out of balance, too much stress. That will beat up the thyroid. Now, an underperforming thyroid, usually I'm looking for T4, T3, reverse T3, TPO, which are thyroid antibodies, TTG, which is another thyroid antibody, and TSH. Now, these can be up or down relative to whether if you're hypo-thyroid, meaning your thyroid is not working fast enough, or hyperthyroid, meaning that it can be working too fast. Or you can be both. You can fluctuate between the two. because things get out of balance once again. So to quickly review this, what causes the system to get out of place, really, what it comes down to is stress. And that stress could be dietary, as I talked about, not quality sleep, work stress, toxins in the air or water or ground or wherever it can be, too much exercise, not enough exercise, grains, sugar, dairy, all the oses, beat up the thyroid. And your thyroid, as you all know, as I've talked about before, is the master metabolizer of the body. It also communicates with the brain. So when your thyroid gets out of balance, you can have some neurological complications which can lead to things like Alzheimer's, brain fog, dementia, even Parkinson's. Those are the main genesis of what's going on with diseases in our society. So when I sit down with a person and I look at their lab work, I look at big time A1C, triglycerides, glucose, insulin, cortisol. Those are the main biomarkers that I look for. Now, these biomarkers getting out of balance can lead to cancer, can lead to, once again, dementia, Alzheimer's, heart disease, you name it, all kind of diseases, osteoporosis, eczema, even muscle cramping, extreme muscle cramping. So the disease process really is anything where the body's out of balance. I hope that answers your question, guys. I appreciate your time watching this. If you have any questions about anything, please contact me. My number is 816-405-7703. My email is rwpsports@yahoo.com. I will be more than happy to sit down with you and go over some lab work with you, to go over some lifestyle assessments, to do some one-on-one training with you, consultation with you. Please contact me. Take care of yourselves and God bless you and your families. Bye-bye.